Here's a scenario. What would you do if you were a witness of this situation? Would you A. Pick her up and tell her to walk it off? B. Call an ambulance? Or C. Start to panic because quality healthcare is expensive and you can't afford it? Well, some people would choose A, if they hate their grandma. Some may choose B, but many around the world would choose C.
The lack of access to quality healthcare worldwide is a growing issue that's been severely overlooked, and as a result, many countries have been affected by this, particularly those in less developed countries.
That's why in this video, we are going to inform you about the lack of access to healthcare.
So, what is healthcare? Healthcare is the organized provision of medical care to individuals or community. And by having access to healthcare, we mean having affordable and quality medical services. Its significance is an underrated service of the world. It helps in more ways than you might think. For example, not only is it about curing illnesses and treating the wounded, it's about educating the public on personal hygiene and health.
Now, when we refer to the lack of access to healthcare, it means that individuals and communities are unable to receive the health services they need without suffering from financial hardships. It also means that the quality of those services is not good enough to improve the health of the people who receive them. In other words, it is the inability to make use of the provision of medical care and services when needed.
Why is this happening? Healthcare costs are high due to healthcare providers taking advantage of it to make money by funding unnecessary services and charging excessively. On top of that, the lack of universal financial protection still remains an important aspect in the lack of access to healthcare.
According to the Commonwealth Fund, 43.4% of U.S. adults aged 19 to 64 were inadequately insured in the first half of 2020, which statistically remains unchanged from the previous survey in 2018. Furthermore, the high frequency of errors, inadequate clinical facilities, and practices significantly reduce the quality of healthcare services.
As a result, at least half of the world's population do not have full coverage of essential healthcare services, and this includes 100 million people who are still being pushed into extreme poverty because they are forced to pay for these through out-of-pocket payments. This refers to direct payments that are made by individuals to healthcare providers at the time of service. A study showed that over 26,260 Americans died in 2006 due to the lack of health insurance, and an estimated 162,700 people died between 2000 and 2006 for the same reason.
People are unable to receive appropriate health care. They are left with financial burdens, poor health status, and unmet health needs. These can lead to long-term disability, impairment, and lost productivity, and even premature death.
Okay.
So why are we addressing this issue? Why is it so important that we have access to healthcare? Why does it matter? As mentioned by the United Nations Department of Economic and Social Welfare, having access to healthcare ensures healthy lives and promotes well-being.
Reducing the lack of access to healthcare allows countries to make the most of their resources, as it not only creates opportunities for improvements in health, but also tackles poverty by preventing unnecessary medical charges. To put it differently, by improving health outcomes and reducing additional healthcare costs, quality and affordable healthcare is the foundation for individuals to lead to productive and fulfilling lives, and for countries to have strong economies.
Luckily, these issues have not been ignored. Many groups around the world, such as the International Medical Corps, are working hard to provide for those in need, such as delivering aid for medical emergencies in the case of disasters that countries can't recover from on their own, and training local communities with skills to better prepare them for self-reliance.
Even training medical staff for clinics can greatly improve health services because they can assist more of those in need, such as by helping them recover from complications regarding one's health, thus further guaranteeing the health and safety of the wider community. This can also help hospitals manage patient demands, make more appointments available for patients, and even offer walk-ins.
Apart from improving the quality of healthcare, it is also important to make medical services affordable to the general population. To help reduce the aforementioned financial burden, healthcare providers can inform their patients about the availability of medical insurance and help them understand any existing insurance coverage they may have.
Aside from the actions that governments and healthcare providers can make to improve access to healthcare, it's up to us as individuals to play our part in solving this issue. Though we may not have the power to solve the issue alone, we can still work together to make a change by possibly donating to organizations such as the UN, the International Medical Corps, or even just raising awareness would support those who fight against the issue.
Slowly fixing the smaller issues gives us an advantage to tackle more complicated problems one by one. Achieving our goals won't be easy, but one step at a time we can move forward in expanding access to quality and affordable healthcare.